this is so pivotal in our year, you coming here and basically assessing all of our children. That sets up our whole year, believe it or not, because now we're able to identify all of the eye problems, all of the psychological possible problems, all of the dentist problems, and so we just kind of line up our kids instead of, as opposed to, we wouldn't get to them maybe in 6 months. Like that's the way things are. We have limited resources, so what you're, immediately helping us with is identifying all the biggest problems, and then we can go from there.
Everyone will have the assessment form. As you know, the initial assessment is the front page. This you don't have to really worry about. And then documentation today, so from 11 to 1:45 is Toby and Susanna. And then from 2:30 to 5:30 is Jimmy and Alana. But if you need to check that.
So every year Humber College brings a medical team of healthcare professionals and students here to Guatemala to provide healthcare to 3 small under-resourced communities, both in the urban and rural areas, and we see about 400 children. Another reason why we come to Guatemala is for the opportunity for the healthcare team and specifically our students to work collaboratively on an interprofessional team in order to deliver comprehensive healthcare to the children here. And what they're able to experience is what the World Health Organization describes as the domain of learning for interprofessional education. And that includes things like team building and communicating, learning what each other's roles are, ethical practice. But most importantly, it's to all work together with the same focus to improve the health of the child or the patient that you're caring for.
Here you have paramedic students practicing with practical nursing students, with the RN, Bachelor of Nursing students, with physicians, with nurse practitioners, with the psychologist, with the dental care provider. And so you have a full team approach to the management of children, and this is something that is a dream come true for us in learning, because we know that in order to implement team-based care after graduation, the best results come from learning how to do that while in the programs. And so that's why we're so passionate to come here, where we can actually implement a true interprofessional model where we learn from, with, and about each other. And so that the hope is that likely after graduation, they're going to know how to communicate with the dentists and the doctors and the paramedics. They're going to know their roles. That's really why it's so important for us.
I am very nervous because I don't know what to expect, right? I got the language on my side, and it's a very new experience for me. The interprofessional collaboration, it's a great thing. It's essential for my career, for my future career. And I know it's gonna be a great experience.
What I want to do, anybody who feels like sharing first of all, their aha moment, something that they learned that really made an impact on them. So your aha moment or best learning today.
I learned how to chart medication. Yeah, as a paramedic, it's a big feat. It was nice because now when we go to nursing homes, for example, or patients who had just been discharged from the hospital and then they came home a couple days later, they're having pain again. Now, I feel more comfortable being able to look at their charts and their records and really understand, you know, what happened and what medications they were taking, what they were supposed to take, and then asking them if they've been compliant.
I want the people that I can sort of mold here, the Humber people, to push your thinking in seeing where it could, these things that you're going to see, smell, feel, hear on this trip, where it could intersect with your roles. So on surface, as we discussed today, it appears like a medication administration record would never intersect with a paramedic. But once we pushed the issue and we talked about the types of roles, we came to the resolution that you'll pick up patients from a long-term care home, you'll pick up patients from a palliative care home where things have panicked out of control and there's now an aggressive call, and you may be handed an MAR. And you may have to analyze that and give that information back to the healthcare team once you get the patient to the emergency department or wherever you're headed. And so I want to push us all in, just because on the surface it doesn't look like it could intersect with your role, that it might be some applicability. That's what I think there's good learning to happen here today, that we're all intersect when it's that patient at the center.
As the next 10 days progress, it's going to be busy. There's lots of work to be done, lots of patients, especially when we go out into the rural places. There'll be like 65, 70 kids to see in 3 hours. But I think this is a great bunch. This is my second year here, and the dynamic feels very strong. I'm looking forward to the next 10 days.
Jeremy has this condition.
Muscular dystrophy.
Yeah. So he has to have daily medicines.
Yeah. I would expect she's still able to keep up.
So this morning I was part of a team that went off the compound, the orphanage compound, and we went to see a family that Frankie and Dara, one of the ladies here, follows every year, basically. So they follow them, and we were just basically going in to check in to see how they were doing. When we went there, we found there was about 17 individuals living in one small room. There was children, various ages, and then a couple of adults. So we went with Dr. Trent, and he provided a lot of the assessments for a few of the children. Unfortunately, we couldn't see all of them. We tried to prioritize and ask, you know, if there was any children that had chronic issues that needed to be seen. And we were able to see about 4 or 5 of them, which was great.
Working with the nursing students, we find out what they do more of and what their role is in the hospital, so then we can kind of guide what we need to learn about our patients in order to answer those questions and make their lives easier. Much like they're learning about what we do, so that they are more understanding when they come in and they're like, well, why didn't you do this yet? Like urine analysis, that's not something we as paramedics would do. And they're understanding that now, that we don't have the same scope of practice.
Following the children through like our nursing assessments and then being able to follow them into their appointment with all the pediatric doctors has been a great experience, because it kind of takes your assessments as a nurse that much further. You get to know exactly what the doctor is going to probe further. So you will do your original assessment, and then anything that you've kind of missed, they'll probe further so that you can fill in gaps in your nursing assessment. Being able to work with paramedics, we're able to teach each other wherever we're kind of lacking in our disciplines or wherever our focal point isn't. We're able to actually gain further knowledge, which will help us, I believe, when we get into the workforce in the future.
So earlier today we went to a red zone district area. So this area in particular was actually the aftermath of a mudslide. So earlier this morning we visited a family who still live in this particular area, and they actually, because it was their home, they didn't want to leave the area. And so we actually helped do some physical assessments with one of the doctors, and then we just had like basically what the same assessments we would do with the kids there, and then see if there's any help we can give. give to them. And so earlier today, we actually helped did some ear wax extraction. This experience here will help me overall as a person and as a paramedic. Here we have like a wide range of interprofessional. We see how doctors communicate with the patients. We see how nursing students communicate with the patients. And this kind of like just broadens your view of like how to approach a situation.
One challenge, I guess, like as a nursing student, there's always the confidence challenge, meaning that when you're surrounded with people with a lot of experience, you know, you kind of feel inferior at times. You may feel like your knowledge is not up to par. You might feel like, you know, you're not matching their expectations, right? I think that's normal though as a nursing student, and I always remind myself that I am in a learning role, and if I look at how these doctors are helping us, and also like everyone else on the team, they're actually supporting us. So they're not making us feel like we're any less, and they're actually helping us to grow. I feel like I'm being nurtured in so many different ways. Just being here is like growing, I feel. So I feel like being on this trip, like I'm close to the end now. I'm in my 4th year, and it's kind of affirming my decision to be a nurse. This is why I got into it. You know, it's to help those that are vulnerable, those who live on the fringes of society, those who need most help. And I'm glad that I can be in the position to help these people with a wonderful team.
The idea of the interprofessional healthcare team is something that we get told a lot about in school. And part of the idea is that you have people who do have different specialties and what it means to be able to work across those specialties and know other people's roles and other people's strengths. Something that we sometimes don't see in practice is the strengths of the doctors coming out, the strengths of social workers and psychologists, the strengths of nutritionists. But here at VIA, it's an opportunity to see, to feel, to be coached by the doctors directly. And that's not something that I get in any of my placements.
They're able to gain a deeper understanding of global health and global health disparities. And they understand in a deeper way that all the healthcare problems of the world don't come from the South, and not all of the answers come from the North. And that if we work collaboratively and together, that we can really gain a lot of knowledge and understanding from each other.
To come with doctors, nurses, and psychologists together in order to have a cross-reference and to check on different disciplines, right? It only benefits the student and the young children. So I think it's very helpful. And so far, you have been doing this as long as I'm being here, so it has worked great. Yeah, it gives the doctor and myself a physical point of view, so we can work on that and have this dialogue among disciplines, right?
All of the families who live here are invaders. They seek places where they don't have to pay for the land. So, since this is a very big ridge, when the ridge gets filled with trash, that becomes their new home. A lot of kids work here. They are not allowed, but that's the only way they can eat. So it's really, really dangerous to work here. And again, what I told you, and this is the last thing I say, it's, what if this was the only opportunity I had to work? Or my mother, how would I feel if my mother works here? So we'll stay like 4 or 5 minutes more and think of that. How would I feel? And that's gonna make you treat them as you would like to be treated when you go and do the medical work with them.
People really live in the context of their own lives, and so you have to kind of just get on their level, whatever level that is, and just see them for who they are. Like, not everyone needs like you need, not everyone loves like you love, not everyone has what you have. But if they're happy, or you can help them meet their needs in whatever way their needs are defined, then that's how you accomplish your goals. So going back home to Toronto, just taking that extra time to ask people, you know, what their needs are, what their goals are, and how I can best help them to meet those needs and goals. You know, that's what I hope to accomplish, and that's what I've learned from this experience.
People are always pitting people against each other. Like the paramedics, they just bring them in, and the nurses do all the work, or the doctors do all the work, and it's working alongside all of them at the same time. It just puts everything into perspective, and it's like we all have different jobs, but we're on the same team.
Yo pienso que es importante las prioridades, es siempre la salud en los niños, que son los más vulnerables en cuanto a sus defensas, y también pues ellos mismos necesitan del cuidado, y muchas veces los papás, por falta de recurso económico, no pueden ayudarlo. Y las dos prioridades, pienso yo, siempre es la salud y la educación.
I feel that the effect here is we're not improving population health on a national scale, but what we are doing is coming into places where, for the most part, we're complete strangers, and we can spend a day in a community showing love and kindness and respect to people who we've never met before and we might never see again. And I think that helps to illuminate the possibility of showing love and respect and kindness to people who aren't your immediate family, who aren't your neighbors. And I think that, to me, is something that I'll take away and want to incorporate into my practice.